Hi, it's Coach Candace here, and I'm here to go over a standalone trend Next Gen NCLEX practice question here with you. And let's go. All right, so we are working with standalone trend, which means you're going to see in your question at some point a trend. So a trend can be varying times. Usually there's some kind of time variation because it's a trend that you're looking at, all right? And the makers of the NCLEX want to see if you can look at change in patient data over time and make an appropriate decision about what you might do for that patient, okay? It's a matter of safety generally. So it's always a question that has some level of priority, right? And it's just another one of the alternative formats on the Next Gen NCLEX. So let's get started. All right, let's just always start with the information that's provided to us here on the title screen, and it usually remains the same regardless of which of the tabs you decide to use there on the EMR or the left-hand side of the NGN question. If you do have tabs, sometimes all you get is a chart with some information. All right, so with that said, we'll start here. The nurse in the outpatient laparoscopy clinic is caring for a 49-year-old female client. All right, so here's the client's name, Christine Lynn. All right, she's a 49-year-old female. The procedure is an outpatient lap chole or laparoscopic cholecystectomy, and she is post-op status 8 hours post anesthesia. All right, the past medical history is non-significant, and the code status for this patient is a full code. All right, so we have our nurse's notes here, and there are going to be some assessment findings there on the nurse's note and current orders that you'll find here on the same page. So, what are the assessment findings? The last void was pre-op at 9 a.m. All right, the patient received 1,800 milliliters of IV fluids intra and post-op. The patient reports lower abdominal pressure and the bladder feels full. The patient's unable to void despite warm water, like the technique where you put your fingertips in the warm water, and an upright position. All right, the patient has ambulated once with assistance, and the abdomen on this patient is distended, and there's suprapubic fullness noted. All right. What is suprapubic fullness? Do you know what that is? If you do, go ahead and put that down in the chat for me and let me know what you think that is. All right. Kind of from your anatomy and physiology days. So most of us should know what that is. All right. Pain, 3 out of 10 at the surgical site. That is the other piece of information that we have there. Oops. Apologies. That's the other information that we have there. Pain, 3 out of 10 at the surgical site. All right, what are the current orders? PO fluids as tolerated, ambulate with assistance, acetaminophen hydrocodone 5, 325 milligrams PO Q6H or Q6 hours PRN. All right, void before discharge, and then discharge criteria checklist in progress. All right, that's all the information that you're getting there. And I think you're also going to get some vital signs that I'll show you on the next screen. All right, so I think I also wanted to let you know about the instructions. All right. So they're usually indicated with a chevron or right facing arrow here, and it'll give you the instructions that are appropriate for this particular question type. All right. So here we have for each indicator. Click to specify if the finding indicates that the client's status has improved, worsened, or is unchanged. All right, note each row must have one response option selected. All right, so we're changing over time in this patient, 0 hours, 2 hours, 4 hours. All right, and you have your voiding status here. You have your bladder scan amount or volume here. All right, and you have the intervention in the column here, the nursing intervention. And then you have a little bit of a note here. All right, and you're going to use this information to determine whether or not this patient has experienced an improvement, or whether or not the patient has worsened, or whether there is no change at all. So hopefully you're taking a look now at the table that we have here. All right, each row must have one response option selected. So this is the multiple choice matrix question. All right, so let us move on so that you can take another look at those vital signs. All right, we've seen them in another type of question, right? We had the bow tie question earlier, and we also had the full six-part unfolding case scenario version of this question over on our other channel. Excuse me. So, have you had a moment to think about your answer choices? Let's now look for the correct response. First option, all right, voiding pattern. Has this patient's voiding pattern improved over time? Has Miss Chin's voiding pattern improved over time? All right. You're basically looking at what you had from before. You're adding to that what you've noticed about the voiding status, all right, at that last reading. And it appears that she is voiding normally. All right. So are we improved, worsened, or no change? If you went with improved, you are correct. All right. What about the bladder scan volume? Is it improved over time? Right. At 0 hours, it was 680. In 2 hours, it was later, it was 220. All right. And at 4 hours, it was 220 again. Okay. So is that an improvement? Is that worsening? It is an improvement. Absolutely. Okay. Now moving on to client comfort and distension. Did that get better? All right. Well, how do we know? We need to look at the notes. We need to look at the information that we have there. What did you go for? All right. Did you go for an improvement? Well, then that will be correct. And what is it based upon? All right. What is that improvement based upon? All right. Throw that in the comments for me so that I know that you're picking up what I am putting down here as Coach Candace RN would typically want to do. All right. I want that feedback from you. I want you to let me know if I am effectively passing along to you some information that you need to know. All right. So with that, put it in the comments for me, and I'll get in the comments with you too. Okay, surgical site healing. There's really nothing, no change there. Nothing to indicate that there's any issue with the surgical site. All right. So always be, looking out for that kind of information because NCLEX does throw in there sometimes information that you really don't need. So you got to know what to pick, how to be selective with the particular question information or data that you have in your question. All right. Well, that handles that question. All right. And if you just want to remember a few points about urinary retention, I will point this graph to you, right, so that you can take a quick moment to review. All right. So when does it occur? Usually immediately to 3 days post-op, right? Post-op. And it's usually brought on by some issue with the anesthesia. But there are other issues that we'll get to in a second. Obstruction of the urethra, though, is the primary cause for urinary retention or hesitancy, right? And it puts a patient at risk for hydronephrosis. Do you know what hydronephrosis is? I don't have time to go over every single concept here, but I want to know that you guys are looking at what's most important about the information that you see. All right. Terminology or medical terminology is very important for NCLEX. If you don't quite know what a term is, it puts you at a bit of a disadvantage for being able to answer those more difficult questions, the ones that you get more bang for your buck with, the ones where you get to finish the test early because you knew what that term meant and you were able to demonstrate that to the algorithm. All right, so hydronephrosis, put what it is down in the comments. All right, acute or chronic etiology, edema, BPH, sorry, tumor. All right, so those could be causes for urinary retention, as could inflammation, post anesthesia status, right? Our patient that we just had there was post anesthesia, or stroke. All right. And how does it show up in the clinical setting? All right. What are the manifestations? Inability to void. You'll see that terminology. Bladder distension, right? We want to show you the terms that you'll see on the NCLEX. Restlessness, particularly in our older patients or ones that are immobile or perhaps have cerebral issues. All right. Increased blood pressure. You might also see that in our patients with mobility or central nervous system issues. All right. So besides that, we have, I'm going to slide this over here. All right. What are our interventions? Our nursing interventions? Well, we're going to want to position that patient upright. All right. We're going to provide privacy so that they can relax and relax the sphincter there. All right. Hands in warm water, that technique where you put the fingertips in some warm water to stimulate a relaxation response. All right, the bladder scan is an option as well, so you can see what the volume um, of urine is in the bladder. All right, ensure adequate fluid intake as ordered. Right, offer the bedpan, I and O. All right, what is I and O? We like to throw out these abbreviations all the time, and you very well could see this one on the NCLEX. What does it mean? And then finally, I always like to share with you a couple of medications that you might see in these different conditions that I will be reviewing each week. We'll be dropping a new NCLEX Next Gen scenario question, as well as these bow tie questions and trend standalone questions just several times a week. All right. So when we do that, I always want to share with you a table like this so you can have something to work with and share in your NCLEX planner, right? And use it as a study guide, an active learning study guide or tool. All right. So with that said, that medication is bethanyl chloride, and that could possibly be a part of the profile for your patient in terms of interventions. All right. Well, I do thank you for your time. Well, what's that? That's a straight cath. We don't have it listed here, but I put it here to remind me that it's possible that your patient would, a straight cath might be ordered for your patient. So that's why you want to let the physician know if your patient's not voiding, especially if we have all of these other manifestations here and you've tried some of your nursing interventions. Okay. All right. Well, do subscribe here for more and absolutely join me at my live Zoom sessions that happen right now. They're happening during the weekends on Saturdays and Sundays, and I'm there for 2 hours each day. And we are going over my coaching package that's available to you at a self-paced manner, but also you can join in on those classes. You would have access to that too by going over to my stand store. All right, check us out there and I'd love to see you. All right, take care. Bye bye.